Good morning and welcome to the Care Navigator user group call, August 27th, 2021. I'm Danielle Palmer and I'm going to go through some demonstrations this morning. Here's a look at our agenda today. I'll be showing you the 3 prioritization lists. I'm going to show you how to create a patient list by provider and then by practice, and then I'll save the filter list as a new view. I'm going to show you how you can add, deactivate, and then reactivate care team members. I'll show you where the lead care coordination change history is, and then I'll show you how to mark your patient deceased in Care Navigator. So, moving along, I'm going to go ahead and click into Care Navigator here. So the 3 lists in Care Navigator, they show you patients with high ED utilization, high inpatient utilization, and high care coordination risk level, coupled with a high social risk score. So to view those lists, hover over Care Navigator and click on Patients in orange. It'll bring you to active patients. And then if you click on this drop down, you'll see the 3 lists right here. Active high ED utilization patients. So click on that and it will return all your patients for this view. And then here's your high inpatient utilization patients. And then for your high medical and social risk patients. So those live there. Of course, it'll look different for everyone. It'll be based on your legal business unit or organization. And to coincide with that, in the encounter log, if you want to record an encounter as showing outreach for the prioritization list, what you would do is you click into your patient's records. So I'm going to use Gail Matthews, test patient. Click on encounter log. And here's the care management encounters. Click on the plus sign. For visit type, it's care management. You pick the type of contact. Maybe it was a home visit or a phone call. And here it is under encounter purpose, the prioritization list outreach. So you can select that. You can select just that one, or additional items can be chosen. Pick as many as needed. And then you would put your note in here. Okay, just going to close that out. Okay, I'm going to go back home. The next thing I wanted to show you was how to create a patient list by practice. So hover over Care Navigator and go to Patients in orange. Just need to back that out. So you should be an active patient, so you're returning all your patients. So what we're going to do is we're going to create a view from this list, so it's like filtered down. So the first thing you'll do is click on this funnel. It's the filter, and it opens up all these. And I'm going to scroll over until I find attributed practice name. Click on this drop down. I'm going to filter by specific attributed practice name. I'm going to use Winooski Family Health. And you can search, place a check mark here, select, and add. And it returns all the patients that are attributed to Winooski Family Health. I do have these steps written out in our PowerPoints that you'll receive after if I'm going too quickly. Now I want to save this this filtered view so that I can easily click into it next time I log in. And just so you know, the views do get the data flows into these views, so they're always refreshed with our newest data that we receive. So you would click on this drop down here next to active patients. And you're looking for save filters as new view. Sometimes it's right here at the top of my list, but often you'll find it down here. It depends on how many views you have created, so it moves on us. So save filters as new view. And this is a name is required. You can see that asterisk. So I'm just going to name it Winooski Family. And you can put in a description if you want, but you don't. It's not required. And then save. So here's my new view for Winooski Family Health, all the patients that are attributed. Now, so if you were just logging in for the day and you want to get to that list, I would say get to your active patients, click on this drop down, look under my views, and here you'll see Winooski Family Health. Of course, I have a few here now because I've been testing and practicing. So you would only have one. So there's that. I'm going to do the same. I'm going to actually do a list by provider this time. So from active patients, you would turn your filter on, scroll over to attributed provider, filter by specific attributed provider. I'm going to use Dr. Ray Bailey. Okay, place a check mark in front of their name, select, and then add. Then this returns the patients that are attributed to Dr. Ray Bailey. Okay, and now I want to save this view. So again, click on this drop down, and then it says you'll be looking for save filters as new view. You just have to back out this. However you want it to appear. I'm going to put Ray Bailey, MD. And then I'm not going to use a description, but it is optional. Save. And here's the new view for provider Ray Bailey. And then to get back to all of your patients, you just always use this drop down and get back to active patients. To see your views that you've created, it's going to be under the bold My Views, and there you'll see Dr. Ray Bailey. Okay. And just to mention, you can filter on and create views for any of these fields. So maybe you want to create one by your health service area, so you can do the same. Maybe you want to filter it by care coordination status, reason for engagement, any of these. So it's just the same steps. And if anyone has questions, please feel free to reach out to our help desk and we can help you. So I'm going to take that filter off. I'm going to go home. The next thing I wanted to show you was quickly how you add, deactivate, and reactivate care team members. So I'm going to go to patients in orange. I'm going to use Scale Matthews. So basically, I want to add myself to Gail's care team. So go to care coordination in orange. You'll scroll down until you find current care team. Actually, we're already on it. Okay, click on the grid. So just one moment and I'll show you. Okay, so from active connections for patient, I want to add myself to Gail's care team. So I'm going to do add care team member. And the role, I'll pick care coordinator, participation type, I'm a care team member. And this is where you would select if you wanted to be the lead CC or you've been designated. That's where you would pick that. And then you hit save and close. And here I am on Gail's care team. Now, let's say I'm no longer working with this patient and I need to remove myself from the care team. You simply place a check mark in front of your name and you would hit deactivate and then provide a reason. I'm going to put staffing change. Okay. And it takes just a minute to process. And then it says care team members deactivated, notifications sent. Okay. The next thing I want to show you is how to re-add yourself to the patient. So let's say I need to be back on Gail's care team. I need to start working with her again for whatever reason. So it's not as simple as clicking add care team member again, because you'll receive an error. It remembers that you were deactivated. So you actually have to go into the inactive connection associated view to re-add yourself back. So these are all the people that were removed from Gail's team who were once on it or who were on it at one time. So place a check mark in front of your name and then activate. And it puts you back on her team. So you just have to switch this back over to active connections for patient. And then here I am back on the care team for Gail. Again, these are written out in this PowerPoint, and also we have modules on these steps if you get confused. And often if you don't know if someone was on the care team at one time and you're just trying to add them and you get an error, it's always a good idea to just look in that inactive connections, and oftentimes you'll see that patient or that care team member listed there, and then you would add them back from there. Okay, so I'm going to go back home. And I wanted to show you where the lead care coordinator change history is. So I'm going to go back into Gail again. Just have to back out. So you'd go into care coordination and scroll down. And here it is, lead CC change history. I just wanted to show folks if you, let's say you were on a care team as the lead and maybe next time you log into this patient, you notice you're no longer the lead, or you get an email saying you're removed. This will tell you who it was changed by and who is the new lead, and then the reason. So for example, on 8/25, it shows that I removed Denise as the lead CC, and it just says care provider removed as lead CC, but still on care team. And then a few minutes later, it shows that I assigned Betty Jones as the lead CC. So that gives you, it opens the door for you to know who changed it, and maybe there's a conversation, maybe you need to reach out, that provides that information there for you. So that's that. And the last thing I wanted to show you is how to mark a patient deceased in Care Navigator. It seems hidden to me until you know where it is, and once you know where that field is, you know, you'll always remember. So I'm going to stay in my patient here. It's actually in the care coordination section again. This is a lot of demonstrations in there, this area. So okay, so care coordination status. You know, it might have said needs outreach or in outreach, but now your patient, you need to mark them as deceased. So you click in the space, scroll down to the bottom. Here it is, deceased. It's the last one. So you click on it, and this field is normally locked. So once you hit deceased, it unlocks the field and lets you put in a deceased date. And then you hit your save disk, and you can see it saving. There it is. So that's where that is. So that's all I had planned for demonstrations today. I'm going to bring us back to our PowerPoint. A couple more slides, and then we'll be finished. Just wanted to let people know that we have a new Care Navigator new user training coming soon. It should be updated and posted in the Vermont Health Learn site early next week. This will be available for any new users joining Care Navigator, and the training will also be available for any current users who just want to go in there and take a look or have a refresher. So that you'll see very soon. And here's just a slide, just some tips for staying active in Care Navigator. Of course, it's always best to log in as much as you can, at least monthly, to retain access. Ultimately, you don't want to go past 90 days because every 90 days it's for compliance reasons, we have to remove users, and so who haven't logged in. And what happens is you get removed from your care teams, and so that's no fun for anyone. So it's best if you can log in before that 90 days. And this is just a page that shows you where our website is. We have PDFs, how-tos, modules. This is where we post the user group recording. So just some helpful tools to guide you through Care Navigator. And as always, please reach out with questions. We have the help desk, email, our phone number, and then for the care coordination questions and the clinical information, it's listed here, and then our website. So I appreciate you all listening, and feel free to reach out with any questions, and I hope you have a wonderful day. Thank you.